Hi, we are going to talk about dentigerous cyst. Definition. Dentigerous cyst can be defined as an ontogenic cyst that surrounds the crown of an impacted tooth and is caused by the fluid accumulation between the reduced enamel epithelium and the enamel surface, resulting in the cyst in which the crown is located within the lumen. Dentigerous cyst, one of the most common type of developmental ontogenic cyst, estimated to be about 20% of all jaw cysts. It is estimated that about 10% of impacted tooth have formed a dentigerous cyst. Their frequency in the general population has been estimated at 1.44 cysts for every 100 unerupted tooth. The dentigerous cyst nearly always involves or is associated with the crown of a normal permanent tooth. Deciduous tooth is rarely involved. Clinical features: age 20 to 40, gender male predilection, site mandibular third molar region. Signs and symptoms: it is an asymptomatic lesion, small size lesions commonly associated with unerupted tooth. Slow growing, painless swelling with cortical plates expansion is seen in large size lesions. On palpation, thinning of cortical plates, crepitus-like sensation. If the overlying bone is perforated, fluctuation. Most of the lesions are detected during the routine radiograph examination due to missing or impacted tooth. Sometimes pain may be present due to secondary infection. Paresthesia on the affected part and pathological fractures of the jaw may occur. Radiographic features. Radiographic examination of the jaw involved by the dentigerous cyst reveals a well-defined radiolucency associated in some fashion with the crown of an unerupted tooth, with the cyst attached to the cemento-enamel junction. Three radiographic variations of the dentigerous cyst may be observed. In the central variety, the crown is enveloped symmetrically. In these instances, pressure is applied on the crown of the tooth and may push it away from the direction of the eruption. In this way, mandibular third molars may be found at the lower border of the mandible or in the ascending ramus, and the maxillary canine may be forced into the maxillary sinus as far as the floor of the orbit. The lateral tip of the dentigerous cyst is the radiographic appearance that results from the dilatation of the follicle on one aspect of the crown. This type is commonly seen when the impacted mandibular third molar is partially erupted so that its superior aspect is exposed. The so-called circumferential dentigerous cyst results when the follicle expands in the way entire tooth appears to be enveloped by the cyst. Histological features. It consists of non-keratinized epithelial lining with 2 to 4 layers of flat or cuboidal cells. The connective tissue capsule is loosely arranged and contains considerable amount of glycosaminoglycans, ground substance. Nests, islands, and strands of ontogenic epithelium are often seen in the connective tissue capsule. Often mucus-producing cells are seen in the epithelial lining. The frequency of the mucous cells is increased in proportion to the age of the patient. The intense inflammatory cell infiltrate in the capsule causes localized hyperplasia or discontinuity of the overlying epithelium. Occasionally, bud-like thickenings of the epithelium into the fibrous capsule may be seen even in the absence of the inflammation. Complications of the dentigerous cyst. Ameloblastoma. It develops either from the epithelial lining or from the nests of ontogenic epithelium in the wall of the cyst. Squamous cell carcinoma. It develops from same two sources as mentioned above. Mucoepidermal carcinoma. It develops from the epithelial lining containing mucous cells or cells with this potential transformation. Differential diagnosis. Adenomatoid ontogenic tumor, ameloblastoma unicystic, ontogenic keratocyst. Treatment. The treatment of the dentigerous cyst is usually dictated by the size of the lesion. Small lesion can be surgically removed in their entirety with little difficulty. The larger cysts, which involve serious loss of bone and thin the bone dangerously, are often treated by the insertion of the surgical drain or marsupialization. Such a procedure is often necessary because of the potential danger of fracturing the jaw if complete surgical removal is attempted. Recurrence is relatively uncommon. Prognosis or predictive factors. Smaller lesions, enucleation. Larger lesions, marsupialization or surgical recession. Recurrence is relatively uncommon.